Let's get back to healthcare right now. The Cleveland Clinic, together with the Mayo Clinic, were cited by President Obama as model hospitals in his healthcare reform plan. The Cleveland Clinic ranked fourth best among hospitals in the country in the most recent survey of the U.S. News and World Report. It was praised for its ability to provide high-quality care at lower than normal costs. So what lessons can other hospitals learn from the Cleveland Clinic? Internationally renowned heart surgeon and Cleveland Clinic CEO Dr. Toby Cosgrove joins us to talk about this now. And Dr. Cosgrove, let me first ask you, after listening to Senator Grassley's comments, and you listened in on that interview with our own Peter Cook, yeah, what do you think about health care reform right now? Is it long overdue?
Well, I think we clearly need health care reform, and I think everybody would like to see people who are not covered have some sort of coverage. It's clearly a step in the right direction. I think where things seem to get hung up right now, and as Senator Grassley really spent most of his time talking about, is the cost of health care. And there is where we need to begin to put the right incentives in place to drive the costs down and still keep quality up.
And then that's obviously the issue that most of the country is focused on. The administration says this reform can cut costs of health care, while the Republicans say that they're just going to add another $1 trillion in costs over the next 10 years. What do you see as far as the possibilities? Can we go forward cutting costs?
Well, I think you always have to be careful when you start taking costs out of things that you don't affect quality. But there are things that we've done here at our institution which I think are fundamental to driving down costs. For example, all of us at the Cleveland Clinic are salaried employees, so it doesn't make any difference whether we do an extra procedure or order an extra test. It doesn't affect us personally in our income. This, I think, reduces the spinning, if you will, of more and more tests and more visits. And I think that way we have, as one of the things that has made us come down in our health care costs. And the second thing is really we worked very hard at the quality of the physicians. None of us have tenure. We all have one-year contracts, and we all have annual professional reviews and get grades. And that helps maintain the quality of the physician staff, which really drives quality across the entire organization.
Can doctors make as much money? I mean, if you're all salaried employees, can doctors at the Cleveland Clinic make as much money as doctors at other hospitals?
We peg our salaries to what the national standards are. We just take away the financial incentives to make more by doing more things. So doctors are well paid. We have a very low turnover rate. They seem to be pretty happy, only 4% turnover a year. So it's a very stable practice.
Let me ask you about some of the other programs you've put. This is the Lifestyle 180 program that I'm referring to, right, where you offer benefits or rewards to people that follow good lifestyle choices. I'm assuming that means quitting smoking or reducing weight if need be. Is this the kind of thing that you could see a need for across the country? We've heard about some other companies doing this, but so far it seems just a novelty and hasn't really picked up.
No, you have to look at what are the major causes of increased costs in the United States. And one of them is obesity. It's estimated that 9% of the cost of health care in the United States can be attributed to obesity. That's well over $100 billion a year. If you look at smoking, that's $100 billion a year. So just those two things can bring down the cost of health care across the United States in a very major way. So what we think is that charity begins at home. So we started with our employees, and we made a statement to our community saying that smoking is not healthy living. And so we went smoke-free across all of our campuses. And then we stopped hiring smokers. And a statement, if you want to work at the Cleveland Clinic, this is the way you behave. And then we went on from there to look at food and exercise amongst our employees. We took trans fats out of all the food that we served. We labeled the food in the cafeteria, the number of calories per serving. We took French fries and all fried foods out of all of our food vendors. And so we provided the right sort of food. And then we went to exercise. And we gave them all free Weight Watchers and free curves. And the first 6 months, we've lost 76,000 pounds as an organization, which is a great...
It's a very interesting, obviously a program for a private company, but can you imagine health insurers also implementing these kind of plans?
Absolutely, and you can imagine, first of all, nothing gets paid for right now by Medicare, by the health insurers, in terms of keeping people well. So if you can have a smoking cessation program, or you can have a diet sort of a program, or nutritional advice, then you can begin to affect those sort of things and drive down the costs. Similarly, if the government began to put those incentives in place in Medicare, you'd really change the habits of the United States.
All right, Dr. Cosgrove, thanks so much for joining us. Toby Cosgrove there, CEO of the Cleveland Clinic.